This is something else that is talked about a lot online and in the conferences as well, is how is the FUE survival compared to the FUT or the strip excision survival? I really don't, on a fundamental level, understand this question, because FUE is essentially the same as FUT. We're taking out the intact follicular unit just like you take out an intact follicular unit once it's dissected from strip excision. The tissue is the same tissue. The growth should be the same. Fundamentally, there isn't any difference in that. Now, it is true that FUE grafts are cut very fine because we're using a very tiny surgical punch. But in today's world of strip excision, those grafts are also cut very fine. And so when you look at the morphology or the grafts themselves under microscope, they look virtually the same. Now, what we found is that with FUE grafts, because there is that issue that they're very fine grafts, we decided not to hand place the grafts. And what that means is that in a typical strip excision practice, the doctor will make tiny incisions and then the technicians will come behind him and place the grafts using forceps into the incisions. We were a little afraid of that, and we decided to use implanter pins, which steps around that, because instead of making those pre-made incisions, I use these pins to put in the grafts myself. The advantage of this is that when you use implanter pins, there is absolutely nothing coming into contact with the bulb of the graft, what they call the dermal papilla, because that is the integral portion of the grafts that will actually grow the hair. Since there's no human contact with the dermal papilla, we have seen better growth with FUE than strip excision. We have seen a counter to that because we used to do strip excision for years. That isn't due, however, to FUE versus FUT. That's due to the implanter pins themselves. The implanter pins is a much cleaner way of placing grafts than by with hand forcep placement. There isn't any manipulation of the dermal papilla, so we get full growth with that. And so when we countered doctor skepticism about is this FUE case going to grow as well as an FUT case, we said you bet it will, because it has to do with not just the way the grafts are taken out, it also has to do with the way they were put in.